meant to visit the dentist. So, but before we get to that, let's talk about oral health care now. What is oral, or what defines a proper oral health care?
All right, thank you, viewers. Thank you, Nigerians. Oral health care simply means the efficient and proper manner at home in which we take care of our mouth. That comprise of our teeth, the tongue, the buccal cavity, the roof of the palate, everything that is inside what we call the buccal cavity, the mouth. The general care of that is called the oral health care, and it is also an integral part of the general body care, because the mouth is the gateway of the body. For us to be alive, we have to eat, and the gate in which the food comes is the mouth. So the mouth care is also a part of the general well-being. So the care of your teeth, the care of your tongue, of your roof, the general care of your gums, making sure they are functioning well in a very healthy state, is called the oral health care.
Okay, so I said something in my intro. Okay, I think you have answered it, because that means it goes way beyond just having a clean teeth.
No, it's exactly, it's not just the teeth. That's why it defines what's in your mouth. Your tongue, your gums, is even, the teeth sits by the rubber around, it's like the tongue is what makes us to communicate. So you have to be healthy for having that. Also your teeth is seated inside the bone. You have the gum, the pink one. So all these things are interwoven. But pretty much most people just look at the teeth, because that is the most visible. So the general oral health care is to make sure your whole mouth is a well-being general thing of your body.
And one other thing that is, will I call it a pandemic, is mouth odor. So I'd like us to talk about it. I'd like you to address what are the causes of this, because you see some people, they say, but I brush, but again the thing is still there. So I'd like you to address that.
Oh yes, the number one cause of mouth odor is what is called gum disease, which we call in periodontal disease in the medical term, but in simple layman term it's called gum disease. It's the primary cause of bad breath, which is mouth odor. And statistics shows that globally is the number 3 most common disease afflicting humanity. About 1 billion people on earth suffer from gum disease. Also of interest that the one that is commonest is also the mouth. About 2.5 billion people on earth suffer from tooth decay. And the second is cardiovascular. So World Health Organization of interest is that for you to stay healthy, for you to enjoy a good life, you can't take the care of your mouth. Now for bad breath, it presents with when you have plaques around your gums, when you have some funny taste after you've brushed, you still feel okay, or occasionally when you bleed, you just see stripes of blood. This shows you have gum disease. And whenever you have those 3 signs, you have bad breath. Now of interest also, in just research, they found out that a Nigerian adult, out of our population, only 1 out of every 4 Nigerian ever visited a dentist as an adult. So if I take a random sampling, if you are 4 here, I assume maybe 1 of you have seen a dentist. Now the other 3 have not seen a dentist. There is a likelihood that just other 3 will have a sign of gum disease. There is a likelihood that there will be bad breath. So it's a real call for concern, so that most people just must be aware. So bad breath is called for us from poor oral hygiene, because most of us, the effective manner of brushing, the kind of toothbrush to use. Many don't floss, many don't brush twice daily. Many, you see a lot of plaques on that. So all this cumulates and cause gum disease, and it also leads to bad breath. I know even why WHO World Health is interested, this disease is correlated with our heart. It makes diabetes difficult to treat. It exposes one to infection of the heart. So it's a
so
very...
if you don't take care of your mouth,
oh yes,
the heart is at risk.
Oh yes, heart stroke, heart attack, infective endocarditis, arteriosclerosis, things that can happen. But most people are ignorant, so they don't know. And also, we don't know why, like life expectancy in Nigeria, currently male 54, female 55. And if every Nigerian, if we say 75 of Nigerians have problems with their teeth, who know where the causative factors are? Who knows what the contributing factors are? But because we are contending as a nation with survival, but in developed countries, they don't joke with it. If you walk to any American clinic, they will screen your gum because they don't want you to die. So I think people should be good to themselves. Make sure they take good care. It's cheap to take care of their teeth. Brush twice daily.
Okay. So yeah, it's established that we must brush twice daily.
Yes, it doesn't cost much to do that.
And again, you mentioned something about the kind of toothbrush that we use. So there is hard, there is soft, there is medium. Are these okay, or is there a better? Well,
I'm not spoiling anybody's business. Producers or manufacturers or businessmen sell because they want to make profit. But as a professional, what we recommend is to use a soft toothbrush. And the common sense is if you want to clean your house and you want effective, if you are using a sweeper, you will not use a hard sweeper. You use a very flexible sweeper to pick up. So the teeth are all scattered, the way they are lined. If you use a hard brush, it won't clean well. And it's also with erode. It will be brushing away your gum. So some people, their teeth keep getting longer over time. So hard brushes, it's negatively affecting.
But are you saying the kind of brush can make your teeth longer?
Oh yes, because it will brush away your gum and your teeth will appear longer. Because the cementum, there's a part that must be covered by the gum, it's now exposed. Some people notice that their teeth appear longer. So hard brush is not advisable. In absence of soft, we can say you do medium. Then we say change it every 3 months.
I was going to ask that. How often do we change our
3 months.
toothbrushes?
You change it every 3 months.
Every 3 months.
Yeah. Don't wait until it flares out. Once it's 3 months, you change it. So maybe when you buy more than one.
Okay, and what's the proper way to brush our teeth now? Because some people do some will say like, so which is the proper way?
Well, I don't have a model here, but
I wish you did.
I wish I did. Yeah. I should have thought of bringing one. But the way you brush your teeth is you brush away from your gum line. Number one, you don't brush horizontally. You brush vertically. And you brush away from your gum line. Number two, when you want to brush, you don't brush with your mouth close together. Because there's likelihood that you are pushing from up, down, down. So you brush with your mouth slightly open. And so you see, it takes a bit of little time. Effective brushing takes about 3 to 5 minutes. But most people do 60 seconds, 30 seconds. Ready to go. So I think it's important that we take little time to go to the professional and they will tell us
how
how
often do we need to visit the dentist?
Yeah, you see your dentist every 6 months.
Okay.
Every 6 months. Especially when they say most people don't visit in Nigeria. So we encourage Nigerians to try and see a dentist every 6 months.
So, but again, looking at statistics or the number of people who come in to see the dentist, do you think that Nigerians are becoming more aware of dental care? Yeah,
well, I mean, from experience in practice, we can say awareness is growing, but the pace is still very little. In terms of, now everyone wants to have a clean mouth. Certainly, we all brush, most people, every day. So now also the consciousness must be, like, they must be informed that brushing by themselves is not sufficient. There is a need to see a professional. So we hope there will be more awareness as time goes, so that most people will see their dentist. So I encourage Nigerians to see dentists 6 months. That's the professional advice.
So still talking about oral health now, you've talked about flossing. So it means, then I also want you to talk about using toothpicks, dental floss, and then the use of mouthwash. And then I've heard some people say toothpaste with fluoride is not good. So I'd like you to also clarify these things.
Okay, well, these are all products out there in the market. Number one, it's best to use toothpaste that has fluoride.
Okay.
because fluoride is the element that makes your teeth strong against decay. Just like calcium for the bone, fluoride for the teeth. So just look for any toothpaste that it says it has fluoride in it. So that's one. Number two, tooth picking, it's a confirmation that you have gum disease.
Especially this one that we
I
just
know
finished.
it's part of our menu list in Nigeria.
Yeah.
Your menu is not complete in a party until, so they are telling you, of course, you don't know ignorant that most Nigerians have gum disease. I don't use toothpick. I don't think anybody around me uses toothpick. Because when you pick your teeth, it shows your gums have a space. When your gum have a space, it shows it has a problem. So it's like somebody scratching his body constantly, and they give you a cream to scratch more. So toothpick destroys the ligaments, the gums that holds the teeth together. So the more, and the toothpicks are, they design some toothpick now that has a floss and a smart one. Those ones could help, but the traditional wooden one that is bulbous, you go in there, it destroys your gum. So if you have 0.5 mm space, or let's say 3.5, when you use toothpick, it goes bigger. So it becomes almost nagging almost every time. So we want to discourage people to always rather get a floss pick. There is this floss set, it has a thread and a floss pick. It has a limitation, but we can say, okay, manage that, but the idea is to use a floss. So toothpick is out. Then for mouth rinses, the best mouth rinse is the nature water, saline water. When you take the blood, you see saline is part of sugar and salt. So the best mouth rinses is to, which is cheap, get little warm water, get little salt, and just use it to gargle. It's all the bacteria in your mouth become neutralizes. They won't be able to perform well. But all the one you bought out over the counter, some of them have acid base, they are negative. It makes you feel good, but it also helps the bacteria to grow faster. Well, a few of them are very active against, like clostridium, but most of them they help. So we don't encourage as professionals. Okay.
Saline water is
saline, it's cheap. So it's actually cheap to keep healthy with your mouth, from your mouth.
Okay, let's quickly talk about oral health care for babies.
Okay.
Especially because a baby, again, that is on breast milk, there are times that the tongue will be white. And I've heard some people say, oh, leave it. And some people say, no, clean it. And so at what stage do you begin proper oral health care for babies?
Okay, for your baby, in as much as 6 months, the first little incisors will keep coming out. So for us, we say as professional, once you begin to see first set of teeth, usually the bottom, you just get cotton roll with just little warm water and clean. Nature, God has designed baby's teeth to be such that they are not as vulnerable as adult teeth in terms of their texture. So I encourage mothers to make sure once they are, at baby 6 months, once you begin to use just cotton wool and water. Then for the tongue, of course, for baby, cells growth and development is so rapid. Their tongue usually is not like an adult where it begins to give you bad breath. When they come like 2 years and all the teeth are there, they have about 20 teeth, then there's a special toothbrush designed for baby. You begin to use that and begin to clean the tongue. At that point, you introduce toothbrush to the baby. You show him or her how to brush, and encourage her to brush in the morning and last at night. So we encourage mothers also, when they get to about 3 years or about 2.5, 3, let them just go to a visit to a dentist, just see how it likes. So these are all lifestyle anyway. So we want to encourage Nigerians to see if they can imbibe this good culture.
Speaking about good culture, are there some kind of food or fruits that can help oral health?
Oh yeah, of course. Like I said, it's a big deal. It has a lot of interwoven. Like your mouth is what gives you your esteem. I'm talking now. I'm sure you're a mouth business.
Oh yeah.
And I'm sure if you have a toothache, it will undermine your performance. It will, if you have a very bright smile, it will undermine your esteem. Now, so we want to tell most people that the food they eat, the quality also affect the state of their oral health. we as much as possible, we discourage sticky, all those carbohydrates that are sticky, chocolates, candies, biscuits, all those things. At a younger age, well, you may do it and brush at night, but once you are getting to a particular age, you want to avoid as possible. You rather take real healthy food, take your veggies, take your fruits. Occasionally, of course, you can take them, but we want to be sure that you don't take much, because those things are the cause of tooth decay. Once you eat those things, they stick to your teeth, and if the statistics says about 2.5 billion, so you don't want to put yourself in the net of those people that have such disease. So we encourage you to eat good meal and brush last thing at night. A lot of water too.
And take a lot of water
Yeah.
too. Okay. We've learned a lot on today's conversation talking about benefits of oral health care, and our guest here has said a lot. Dr. Olukayode Adeyanju, he is the medical director, Divine Dental Home, and of course a dentist. Thank you so much for sharing insight on this topic.
Nice having you. Thank you. Yes.
All right. The conversation continues. Stay with us.
I was robbed at some point. So I was inside a shop, all these Okada riders with all these Okada guys that robbed. They came pretending to buy drug from a pharmacy, my neighbor's pharmacy shop that I was sitting on, only for us to that okay,